Well, a new national benchmark on workplace well-being and leadership will be set up by a non-profit collective called WorkWell Leaders.
This was announced at its annual awards that recognizes those who excel in creating mentally healthy workplaces.
Amongst the winners were IHH Healthcare, NUS, PSA and Otis. We're now joined by Dr. Prem Kumar Nair. Now he's Group CEO of IHH Healthcare and winner of the Wellbeing CEO Award. Thanks so much for coming in this evening.
Thank you for inviting me.
Now, you won this award for creating a workplace that is congenial to mental health. I think doctors, nurses, that high-tension workplace environment, you would expect if there's any stress, it would be there.
Yes. So, I'm a physician by training. I'm also a long-time healthcare executive. And I've witnessed the intense sort of pressure and demands that our healthcare staff go through. And this was obviously exacerbated during the COVID pandemic as well, when they faced considerable abuse from patients, relatives, and even from colleagues. Yeah. So I think we really had to respond to the stresses that the staff were facing. And we put in place a framework within the company. I think this national benchmark that was announced today, together with the national mental framework that was announced by the government, will go a long way, right, in complementing some of the things that we have done as a company.
So, building a culture of well-being has to start from the top. So, being CEO, can you share with us some specific actions that you have taken to prioritize your own well-being and also sort of demonstrated its importance to your employees?
Indeed. So I tell you, it starts from the top, right? The leaders have to demonstrate that they mean business when it comes to employee well-being. So I think the first thing that we did was to make sure that all our leaders were trained. We had workshops during COVID and post-COVID to ensure that they all knew what we were trying to do. We also made a statement in our aspiration. We have a framework. Our aspiration is called Care for Good, and we have 4 pillars. Care for patients, obviously, care for people, care for public, and care for the planet. So this is part of our entire sustainability agenda. So under care for people, that's our staff, right? We stated, right, a number of steps that we would take. And so it comes right from the top, right? And this is vetted by senior leadership, by the board. We did a number of things. For example, in Singapore, we started a movement called BEAM, because every employee matters, right? And this is really to let everybody know in the hospital, the doctors, colleagues of nurses and all that, that because every employee matters, it also means that we are watching to see what happens, all right? If there are abuses in the workplace, we will take some steps. Some disciplinary measures, we'll take some action to ensure that staff are protected. A lot of staff came forth, right, to actually tell us that this was happening, that was happening.
So it's not, but I think you would know as a leader, as an employer, and probably as an employee yourself at some points in your life, that it can't just be someone telling you that's a good thing to do. Sometimes to encourage people to be invested in the process, sponsorship might be necessary. So this executive sponsorship involving vision, leadership, action, and investment. What is that all about?
It's actually a wide-ranging. There's so many things that we did. For example, I'll give you another example. We invested in an app called Intellect. All right, it's a mental wellness app. All right, that's actually quite well known. We invested in it as IHH Healthcare. We launched it in Singapore. We launched it in Malaysia, in Brunei, in all our countries.
What does it do?
So this app is on the phone. If somebody is not feeling too well, mentally well, he goes into the app, he can get counseling, he can get advice, he can even arrange for clinical therapy sessions. So this has now been launched. It's being used quite heavily by a lot of our staff. And actually, while we don't monitor individual use of the app, but we can see the trends, all right? And I think this demonstrates that healthcare staff, a lot of people expect healthcare staff to be chill, go about their work every day without, any problems. But the truth is, and I think COVID really uncovered a a lot of these stresses, all right? And now we know that healthcare staff, all right, are really under a lot of pressure, under a lot of stress. And in order for them to stay with us, to reduce attrition, right, be happy, be purposeful, these are some of the things that we need to do.
So, Dr. Prem, you've mentioned that you sent some of the leaders to all these workshops, right? But in terms of effectively measuring and tracking the progress of all these, of your employees' well-being, for instance, it's somehow somewhat subjective. So, but what have you found? What metrics has your healthcare found actually valuable?
Well, actually, it is not that subjective. We measure a lot of these things. So, for example, employee engagement survey. In the past, employee engagement survey was all about, oh, are you paid well, right? Questions that relate to their remuneration and all that. Today, we ask them, right, about mental health, well-being. Your supervisor, does he listen to you, all right? Are you able to speak up, all right? Is this a company that has an open culture? So these are all the questions that are now being asked in the employee engagement survey across our group. So we actually have some measurements.
Okay.
And it clearly shows that employee engagement is moving up in these areas.
Thanks so much for joining us this evening, Dr. Prem Kumar Nair, Group CEO of IHH Healthcare and winner of the Wellbeing CEO Award. Thanks for joining us.
Thank you.